Hello and welcome to the Back to Life Chiropractic 5-Minute Workshop Series. We are continuing on our new patient orientation, and we'll start where we left off at the last one. And remember, we do all these workshops. We broke up our big workshops and we made little workshops to keep everyone motivated and on track. So let me get a timer on here and we'll start. And all the information that we talk about is always on backtolifechiropracticky.com. There'll be a little Back to Life logo pops up at the end and you can hit it and it'll take you to our website. So let's see here. So we're turning on our timer. All right, here we go. So remember, this is where we left off last time. Was we talked about ways you could get subluxated, and of course the way I got subluxated was by getting hit by a torque bus when I was younger at Hamilton College, and nothing could get me well. And so I went to MDs and PTs and took medicines and blood thinners, and then finally I was waiting to get surgery. My mom took me to her brother, who was a chiropractor, and he adjusted me, and I was able to walk and get out of bed again after like 2 months of being in bed. And that's how I got into chiropractic. So, and then we talked about how, as your subluxations are leaving, it takes time to remove your subluxations, which are the misalignments of your spine that cause nerve interference. And so don't allow your cells to function properly. And so, so it's not just usually a one-time fix. If you've had your subluxations for a while, it's more like having braces for your teeth. I mean, you got to get adjusted for a while, and then you'll hold your adjustment. And then if you do these lifestyle changes that we're getting ready to talk about next, you have to make lifestyle changes because stress happens. And then stress, let's see here. Your body's programmed to respond to any perceived stress. So, there's always stress in your life, and, it's physical, chemical, emotional. So your body responds to these stresses, and your body doesn't know or care if the stress is from a real life threatening situation, like a confrontation from a tiger, or perceived stress, such as completing or paying your taxes. The body's response will be the same. So understanding this response, and then understanding that one of your primary keys to better health is the ability to inhibit or shut off this response is critical in any wellness program. We intend to share this response with you and show you how your diet, exercise, as well as your thinking all determine your responses to life stresses. So stress happens. So your body's programmed to respond to any here we go. Get on track here. So when your pain perceives a stress, so any kind of stress that you have, good or bad, your body does react to it in this way. So the sympathetic or flight-fight portion of the nervous system is stimulated. So the symptom is being revved up, edgy, inability to relax or sleep, constriction of the arteries, increased heart rate, and blood pressure. So the next thing is nerve supply and blood supply to the gut is decreased and to the periphery is increased. So your symptoms are decreased digestion, acid reflux, bloating, constipation, irritable bowel. So the next system is the nervous system decreases reproductive hormones. So your symptoms are sexual dysfunction, lack of drive, and the pituitary decreases growth hormone. So your symptoms are inability to build muscle. So the adrenal glands, the next thing in the cascade of stress is the adrenal glands release adrenaline and epinephrine and cortisol. So you get increased blood sugar and hypoglycemia and diabetes. So the next thing that happens is cortisol causes the liver to reduce HDLs, which is good cholesterol, increases LDLs, which is bad cholesterol. So the symptoms are high cholesterol and increased cardiac risk factors. This increases cravings for sugar and for fatty foods. So the next thing is your adrenal hormones stimulate the amygdala emotional center of the brain to call on previous memory. So at the same time, logical thinking centers are inhibited. So the symptom is difficulty remembering and learning new information. And cells of the hippocampus have actually been shown to shrink. So the next thing that happens is the adrenal hormones increase sense of touch, smell, hearing, and sight. So the symptoms are easily distracted, poor attention, increased sensitivity, and the heightened pain perception, like fibromyalgia. So the fight response will also result in a decreased sleep. So shortening even one, let's see here. There we go, I'm sorry, I got dropped too far ahead. There we go. So the fight response will also result in decreased sleep. Shortening even one night's sleep of 4 hours causes a significant reduction in insulin receptor sensitivity. Chronically, this reaction, coupled with high blood sugar, leads to type 2 diabetes, syndrome X, heart disease, obesity, cancer, and chronic fatigue. So in short-term stress, serotonin would be released to inhibit the release of noradrenaline to help to help stop the stress response. However, in the chronic stress, serotonin production cannot keep up, resulting in depression, fatigue, and trouble sleeping. So the bad news, these pathways are fired in the spinal cord and brain, the body becomes more efficient at processing them. So you get neuroplasticity, you get into a habit, allowing you to move into stress physiology more quickly and effectively. But the good news is the stress response can be shut off by making lifestyle changes. We will show you how proper lifestyles based on the principles of Back to Life Chiropractic, connecting to Wellness Get Fit program. And Back to Life program is all on our website. So that's the end of our 5 minutes. So we did get through the stress cycle, which was a little stressful. So let's see here. So we're going back here. So remember, you can get all this on our website, www.backtolifechiropractic.com. So, and remember, all the Back to Life Chiropractic 5-minute series are actually on our YouTube channel, so you can follow us there too.